Are you considering getting Invisalign in Victoria, British Columbia? In this video, I answer some of the most common questions I get from patients about getting Invisalign. Sometimes, for aesthetic or functional reasons, we decide that we should move your teeth. And what Invisalign is, it's a series of clear aligning trays that are a little bit ahead of where your teeth are currently towards where you want them to go. These trays are worn in sequence. So if you say wear them for a week, at the beginning of the week they feel a little bit tight, and by the end of the week they're quite comfortable, and then you take them out and go to the next tray, and the next tray, and the next tray, until we get to the position where your teeth are that we want them to be at. A couple of things to add to that is that to get the motion that we want, sometimes we add little resin buttons to the teeth that the tray locks into to get the forces that we need. So that's one thing. Also, sometimes if there's a discrepancy in the amount of tooth structure that there is on the top teeth versus on the bottom teeth, we use a disc to go in between the teeth to change their shape a tiny bit. And that doesn't hurt the teeth long term, but it allows us to get a better result at the end. There are several reasons. The first of which is if the teeth don't look right. They've moved into a situation that doesn't look appealing. That's one reason. Another one is a functional reason. Sometimes the teeth, for a series of factors, get into a position where they start wearing too fast, and they're starting to destroy each other. So we can use Invisalign to put them in a situation where they're more harmonious, because in almost every circumstance, it is far easier and far more cost-effective to prevent damage than to wait for it to happen and then to have to do a reconstruction later. So Invisalign is a way to allow us to set up the teeth in a harmonious fashion where we can either completely eliminate wear or greatly reduce it to a point where it's not going to be a factor by the time. So for you to have your teeth healthy for your whole life. So there's two parts to the appointment. The first part is that my assistant will work with you to gather up some records, pictures, a digital scan of your teeth, and some x-rays. And then once we have this information, I'll come in and then you and I will go over that together, and we'll use that information to see what's the issue, what's going on, what we're trying to address, how we would address it, and what that would look like. We have a simulation that you and I can work with to see this is the problem, this is what this is causing, and if we address it by moving the teeth in this position, then this is how that would address it. And it makes it really easy for you to understand why we're doing it, what that would look like, and the result after that. So the answer to that is, it depends, and usually it's not bad at all. The first tray is usually the one that's the tightest, and there can be some discomfort for that because there's a bigger gap in time between the time that we take the scan and we start the trays. So usually the first week is the worst, but it's not that bad, and you can manage that usually with nothing. But sometimes a little bit of Advil or Tylenol will take care of it. Subsequent trays are very, very incremental, so then they tend not to be they tend to be pretty comfortable. But one trick that many patients use is that they change their trays right before going to bed. So they put in the new trays, fall asleep. By the time they wake up, the tightness is gone, and that usually handles it pretty well. And that depends. It's on a case-by-case basis. The more complex a movement we need to make, the longer it takes. So a simple aesthetic change usually can be quite quick, whereas more complex and comprehensive changes can take much longer. So the best way to do that is to look at it together, and once we have that information, we can talk about the expected time frame. Both of them, we can achieve a lot of the same things with both. They're both basically ways to apply forces to teeth in order to move them in a different position. The advantage of Invisalign is that aesthetically it looks far better, and the maintenance and the cleaning is a lot easier. You can take them out, brush and floss your teeth, and put them back in. So that's great. The compliance is an issue. So sometimes, if you have a teenager where we're not sure that the compliance can be good, traditional braces are better because they're fixed to the teeth. But if somebody knows that they're doing this for a reason and that they're going to be very compliant, then in a lot of cases, Invisalign is far better. So one of the more common questions, I guess, how much does it cost? And the answer and / non-answer is it depends. It depends on treatment complexity and treatment time and various factors. So the best answer I would have for you is that if you come in for a consultation where we get the records and we can look at it together, we could talk about it, because I can't tell you, there's no one answer that will fit all cases. The difference is that there's very, very few situations where these mail order kits can do a good job. The reason for that is that when we're trying to move your teeth, oftentimes we need to add little attachments on the teeth that the trays lock into to get the forces that we need. When you get a mail order kit, you can't do that, so that unless the situation is perfect, you're not going to get a good result for all the teeth. The second thing is that if there's any discrepancy in the amount of tooth structure you have on the top teeth versus the bottom teeth, oftentimes we use a little disc to minimize that difference or eliminate it, to get a good amount of tooth structure to work together. And again, with these mail order kits, that can't work. The third thing is the monitoring. If anything, teeth don't behave exactly like we want them all the time. It just doesn't happen. That's just reality. So that if something's happening, a tooth is not tracking, sometimes we take another scan and get a new set of trees to recapture that tooth and send it back in, or change something. And again, with those kits, that just can't happen. So there's a very narrow set of circumstances in which case these kits do a decent job, but most of the time, it's a much inferior product. Thank you for watching this video. I'm Dr. Girard at Oaklands Dental in Victoria, BC. You can learn more at our website, oaklandsdental.ca.